Liver cirrhosis is a serious health condition. It happens when the liver is damaged over a long period. This damage leads to scarring and hardening of the liver tissue. A cirrhotic liver struggles to perform this vital function. As the condition progresses, it can lead to liver failure. It's crucial to understand the causes, symptoms, and treatment options. Early diagnosis and treatment are essential. There are many causes of liver cirrhosis. Chronic alcohol abuse is a major contributor. Excessive alcohol consumption over many years can overwhelm the liver. This leads to inflammation and eventually cirrhosis. Viral hepatitis, particularly hepatitis B and C, is another significant cause. These viruses attack the liver cells, leading to chronic inflammation and scarring. Nonalcoholic Fatty Liver Disease, or NAFLD, is on the rise. It's linked to obesity and diabetes. NAFLD causes fat to build up in the liver, damaging it over time. Genetic disorders, such as Hemochromatosis and Wilson's disease, can also cause cirrhosis. These conditions disrupt the body's natural processes. This disruption leads to the accumulation of harmful substances in the liver. Other factors include autoimmune diseases, drug-induced liver injury, and prolonged exposure to toxins. Liver cirrhosis often has no symptoms in its early stages. As the condition progresses, noticeable signs may appear. Fatigue is a common symptom. It can be persistent and debilitating. Jaundice, a yellowing of the skin and eyes, may also occur. Other symptoms include loss of appetite and unexplained weight loss, nausea and vomiting, swelling in the legs and ankles, known as edema, itchy skin, and easy bruising or bleeding. In advanced stages, cirrhosis can affect brain function. This leads to hepatic encephalopathy. Symptoms include confusion, disorientation, and difficulty concentrating. If you experience any of these symptoms, it's essential to seek medical attention immediately. Cirrhosis can lead to serious complications. Portal hypertension is common. It can cause ascites, fluid buildup in the abdomen, varices, enlarged veins that can bleed. Hepatic encephalopathy, brain function decline, increased risk of liver cancer. Section 5. Diagnosing liver cirrhosis. Diagnosing liver cirrhosis involves a comprehensive evaluation. Your doctor will start by taking a detailed medical history. A physical exam will help assess your overall health. Blood tests are crucial for evaluating liver function. Imaging tests like ultrasound, Connecticut, and MRI provide detailed liver images. In some cases, a liver biopsy may be necessary. A liver biopsy can confirm the diagnosis and stage of cirrhosis. Section 6. Treatment and management. Treatment for liver cirrhosis depends on the underlying cause and the severity of the condition. Lifestyle modifications are crucial for all patients. Avoiding alcohol is essential, as it can further damage the liver. A healthy diet is vital. It should be low in sodium, saturated fat, and cholesterol. Maintaining a healthy weight can help reduce liver strain. Medications may be prescribed to manage symptoms and complications. Diuretics can help reduce fluid buildup from ascites. Beta blockers can lower pressure in the portal vein. Antiviral drugs may be used to treat viral hepatitis. In advanced cases, a liver transplant may be the only option. This involves replacing the damaged liver with a healthy one from a donor. Section 7. Preventing liver cirrhosis. Preventing liver cirrhosis is essential for maintaining long-term liver health. Here are some key steps. Limit alcohol consumption. If you choose to drink alcohol, do so in moderation. Get vaccinated. Vaccinations are available for hepatitis A and B. Practice safe sex. Use condoms to reduce the risk of hepatitis B and C transmission. Maintain a healthy weight. Lose weight gradually if you are overweight or obese. Manage underlying conditions. Control diabetes, high cholesterol, and other metabolic disorders. Regular medical checkups are essential, especially if you have risk factors for liver disease. Early detection and treatment can significantly improve outcomes. Section 8. Living with liver cirrhosis. Living with liver cirrhosis requires ongoing management and support. It's essential to follow your doctor's recommendations carefully. Take medications as prescribed and attend all scheduled appointments. Support groups and counseling can provide emotional support and practical advice. It's crucial to stay informed about your condition. Learn about the potential complications and what to expect. Be proactive in managing your health. By taking an active role, you can improve your quality of life and outlook. Remember, you're not alone in this journey.